and really we're short on people in many cases in the rural communities that are in healthcare. We're short not just on docs, but these executives. It's been difficult over the years, and we're happy to have such a great team. I can't even tell you how much easier it makes our decision-making roles over here to know that there's someone kind of holding it all together. Richard, you have a similar situation in West Hawaii, is that correct?
Yes, I'm like Susan, also on the board of directors for the the West Hawaii Regional Board, which is Kona Community Hospital and the
Kohala Hospital.
Kohala Hospital, thank you. And we're working very closely in terms of referrals back and forth, particularly with the emergency room, and so that we don't overwhelm the emergency room, and that those costs can mount up very quickly for a patient. So if we can see them and take care of things on an outpatient basis. We'd like, I talk about the vertical integration between hospitals and the community health centers as a safety net, and then the private practice physicians and the specialists. And then there's the horizontal, which is through the community health center. We're calling it the circle of care, having a circle of care for the Big Island and being strategically placed with clinics. Paul Bay Clinic has 4 sites from Kau all the way through Hilo, and you heard Susan at Hamakua and North Kohala. We're in Kona, and we just are opening. We have a Keiki Health Center in Kealakekua now, and we're looking at some other sites in Waikoloa for South Kohala, and then even further south in South Kona. So by having those sites, we hope to provide access. But back to your question about the safety net. It seems to me, and it's what you mentioned, Senator, about the changing, because of the economics, there's a changing nature of who the uninsured are, or what the safety net is for. Where before you used to have a lot of private physicians who were taking insurance. Now they're no longer taking insurance. And if they're not taking insurances, people have to pay cash up front, and they may not be able to afford to pay that cash up front and wait for reimbursement. They may not know how to manage even filing a claim. So we're seeing, Kona anyway, a huge number of patients coming in who have insurance, but they don't really have a physician anymore because they can't afford the cash. So that's in a safety net, we know, and there's science to support the fact that if you delay your care, you're going to increase your disease, you're going to increase the acuity of and reduce your health, actually. So, and then you're going to have more costly care because you go to the emergency room or the hospital, and it costs more. So a safety net, to me, is maybe a misnomer. We are, because we see the homeless, we see the uninsured, but we're also seeing those who have difficulty in accessing care.
Well, the safety net has been, yes, it's been evolving, and so I say safety net in a very positive way, that the safety net now means kind of middle class. It's everybody. And just to point out a very specific point, in the course of experience here and in healthcare, people need to know that an emergency room visit, while often a wonderful place to be able to go at last resort, in Hawaii, an average emergency room visit costs $1,024. And those were numbers from last year, $1,024. And a visit to one of our community health centers may cost, on the sliding scale, $15, or it may cost, with the full insurance reimbursement, $60 or $90. And in a time when things are very tight, we really want to take care of everyone. And by having people go to the right places at the right time, we can offer a lot more care. And that's one of the real benefits I see to having a good, healthy community health center system, because you're offering the state, from my perspective, incredible savings. First, you're saving people the suffering from waiting on their health care. And second, you're saving major resources when someone might go to one of our other hospitals and their bill could be several $1,000s. And all of us at this table know no one can afford, if you are coming out of pocket, an emergency room visit. So it's really important that people understand the health economics also.
Yeah, those are points, excellent points, well made.
And it seems as though the economic realities are just increasing the challenges that you all face in terms of trying to provide the best care possible for the Big Island community. And I wanted to echo Josh's comments about, we really appreciate the attitude you folks have about working together, about teaming up, you know, especially given the growing challenges. It seems as though even in our last discussion session when we were talking about the residency program, how people from the community, especially on the Big Island, tend to come together, you know, to collectively, you know, meet those challenges. And it seems today, you know, providing the services you do and being such an essential part of that spectrum of healthcare services, I'm sure financing challenges are also, you know, facing you. And we know that that's one area too where we need to work together, right? Collectively and provide the best healthcare possible. And it seems as though, given the economic realities now, Senator Inouye is in a position where even in the last economic stimulus package, I think provision was made to have, I guess, specific funding provided to the community healthcare centers. And will that help you? And maybe what can we look forward to in terms of trying to work together better to provide for some of the financial needs of the centers?
Why don't you tell us? Yeah, why don't you tell us about what you see going forward, the future of our health centers on Big Island? We have a few minutes left. If each of you could spend maybe a minute telling us what your vision is, it would be helpful.
Well, go ahead. Go, ladies for gentlemen.
Well, I think probably our biggest challenge right now is physical space and the capacity to be able to expand services. We've got more people coming to see us, and we're all kind of